Okay, that's great. So I know some people here, but I don't know everyone. So thank you so much for signing up for this Community Research Academy and for supporting research in your communities. I'm Elizabeth Cohen, and I'm a researcher at Hunter College in the City University of New York, and I also work with the CTSC and the CTSAs of Cornell and Columbia. And I wanted to talk today about a technique called photo voice. And so Larry, who I have the pleasure of serving with on our advisory board for the All of Us research program, which is Columbia, Cornell, and Harlem Hospital, was saying before people got here, so it will be good if we can take some of this and then really figure out how to apply it and use it. And I'm hoping that today's session will help guide some of that application and use. So I want to start out by saying that that policy is often our most powerful lever for health work. It is the, you know, we approach people and we have these individual behavior changes that we try to convince people to do or incentivize people to do. But overall, everyone pretty much agrees that if you can get a policy turn on a health subject, then we can make progress around public health. And in fact, the most effective and meaningful changes have been made using the policy levers. And the policy levers are financing, payment, organization, regulation, and persuasion. And we have seen these policy levers used for everything from tobacco to alcohol to child health, cancer screenings, and I'm going to give a few examples, but the things on this list are all things that you can see in terms of this at this document, but you can find them anywhere, about how health policy has helped to drive incredible health changes in our society. So, for example, when we started, just as an example of some of them, when we started paying for screenings, or not, like when we do and when we don't pay for mammogram screenings affects when and how much women use mammograms. So before that, when we were saying, like, please have a mammogram, or please, you know, your doctors should recommend you for a mammogram, paying for a mammogram and telling women that it's free and sending a free mammogram van that meets them where they are is obviously going to incur more mammograms than trying to kind of talk people into it. Although education is important, that payment structure really helps. Seatbelt use, child seat use, all those things were policy decisions that we made to try to advance public health. So let me see here. So, oh yeah, this dates me just a little bit, but health policy has moved us. So when in the old days, actually, when I was a student nurse and when I was a nurse initially, we could smoke at the nurses' station in the hospital. Crazy. You would never think that now, but in those days, we smoked everywhere. We smoked in restaurants. Yeah, many of you on the call will be old enough, but most of you will be too young to remember this. You could be sitting next to somebody in a restaurant who would light up a cigarette or even a cigar and smoke right next to you. And people would smoke right when you were eating. But additionally, we smoked in the nurses' lounges, in hospitals. We smoked at the nurses' station in the emergency department. There's a picture of nurses selling a patient cigarettes while he's in the bed. I mean, it was madness about smoking. And we've changed the culture around smoking a lot, although it's swinging back just a little bit. But some of these really big health improvements have been made by shifting policies. So one thing we did was tax cigarettes incredibly. So when I was young, cigarettes were like 35 cents a pack. Now, I don't know how much they are because I haven't seen a pack of cigarettes in a long time, but it's probably like more than $5. But that's part of that is taxing, because we're putting that money back into like healthcare now and stuff. So it's really interesting and kind of crazy. This is what seatbelts looked like before car seats, before cars had seatbelts even in the front. Now, when we look at these images, it's hard to imagine, but Certainly as a kid, I was very much one of the people that would sit in the back of a station wagon completely unbuckled. Now I think these would scare us if we saw something like this because we know the implications, but we didn't have seatbelts and then they became the law. And now you wouldn't think of driving, without it, and car seats the same. But, a question would be, how do we get the policymakers' attention? Like, how do we do that? So Gail Brewer is amazing. I've worked with her over time in the Harlem community, but we need to kind of get their attention and try to figure out, well, what is our ask of these policymakers? Where are we trying to go with the health policy? It's not up to them to think of these things. It's actually up to us to think about them and then advocate for them. So seatbelts and car seats were actually the product of an incredible woman who used to be the medical examiner for New York City. And when she noticed that people were dying over and over in preventable auto accidents, she was the one who advocated for car seats and seatbelts. So it's up to the people who can see it. It's up to healthcare providers. It's up to the county medical examiners who are examining these young people who have died to say, hey, this is what we're seeing. Let's use health policy as a lever. And Photo Voice was actually designed to help us do that work. I don't know where you do not see yourself on my screen, right? Or maybe, let me put this to the bottom for now. So Photo Voice helps in transforming some of these participatory action research projects and lending a cohesive voice to it. So it's a methodology that helps us focus our voice and helps us, find this intentional way to foster social change through, it was designed for policy work, but it can be used for other things, but it was really designed with policy work in mind. And there's a number of different studies that talk about that. So what it does is help people see what we see. So I don't know if this person is on yet. I don't think she is.
No, she's not here yet.
Oh, okay. So should I continue and go back to this one, or should I just go over it? Do you think she may be coming, or you tried to tell?
Okay, you can continue with her. We've recorded, so she'll probably see the recording, and if she has any questions, she can email us.
Well, I was going to ask her questions.
Oh, okay.
Well, we can talk about this one a little bit, and then maybe we'll cycle back to it if she comes, and if not, I can ask her. So this is Francie Scalon. So what she did was she thought that it was interesting, the juxtaposition of this Joshua tree and all these people wearing or not wearing their masks. So I would actually need her here to ask her a few questions about this. So maybe we'll go to the next one. And I do know that Mimi Jackson is here, so we can maybe start with this one. So Mimi, a number of people sent pictures of masks, and I grouped them together because it really is leading us in a direction of thinking about policy around masks. And you've actually heard a lot about policy around masks lately. So it's Mimi and Akenna, and I don't know if she's on, and I thought there was possibly one more. So Mimi, are you there, and are you able to talk to us a little bit about the mask, why you chose a mask, and how you think that this might be something that we can adopt as a policy that would help improve our health?
Yes, I'm a dressmaker by profession. So I started making masks. I'm sorry, can you hear me? Okay. Okay. And so I started making masks. I really had no idea how to, I understood basically how to make a mask, but it was something that I discovered how custom a mask is, because people have so many different issues with mask wearing. I have friends who say that, they feel like they're suffocating, they feel like they're being gagged, they don't want to wear a mask. I figured out a way to make them adjustable, so that you could then put it on and then, you know, kind of cinch the cord to whatever level of comfort you have. And also that, you know, I was trying to use interesting fabrics to make it a little bit more of a fashionable item if people like that, and still trying to maintain what a mask is meant to be, that it covers your mouth and nose. I wouldn't take payment for it because I felt like we're in a pandemic, we're in a crisis situation. So any friends who asked, I would just make them. And so I did that for a while. I mean, I still do it now, but I was doing it really, really heavily for a while. And it was a big thing for me too, because it was a healing process for me, because I was healing from a major surgery. That when I got out of surgery, I was at Memorial Sloan Kettering in January. I got out of my surgery, and the first article I read about coronavirus, I was reading in the hospital at Memorial Sloan Kettering. And I thought, oh, what's this? I had no idea what was about to start. And so then I had a really long recuperation from my surgery, and it helped me to make masks while I was recuperating. I wasn't allowed to sit for 8 weeks. So I was making masks standing for 8 weeks. And it felt good to help another cause that wasn't specifically my own as I was healing.
That's amazing. And so, yeah, I mean, that's an amazing story. It's a beautiful mask, and I love the way that it's adjustable. And I think it brings up both protecting people and also a way to heal. And
Yeah.
so I'm going to go ahead with the other mask person. I see they're on the line. And so to hear a little bit more about masks, and then I want to kind of flip it into what kind of policy we might ask about regarding these masks. So I see, Kenna, are you here? I think that person is here, but they're muted.
You could also write in the chat if you feel shy to speak.
Okay, so I can talk a little bit about this one as well. And then, because I think it's a really good one. So this is a collection of masks, as you can see. And they're an essential article of clothing, and they're required in many, many places, but not everywhere, but in New York, certainly. And I'm sticking with the theme of healing. It's important because it affects the health of others by blocking droplets that may be infected unknowingly and spread from one person to another. So there's a number, the themes here are around healing and protecting other people and coming together to do that. So I wanted to think about some of the policy implications then, putting it back in that kind of policy thing. Oh, sorry. I just wanted to move the people down a bit. Little preview. So I wanted to talk about this then around the policy around masking, some of our policies around masking. So how would we talk to, or what kind of policy levers might we think about in terms of using and wearing masks? One of them that you've heard a lot about is the government. The government can mandate that places like 3M make actual, the actual masks. That's another regulation, like policy, organizational one. The government could actually have done that to take over some of the need for the more protective masks. But thinking about it more, we could have financial incentives for people who want to make masks. We could change the societal structure like we did with smoking, right? Like initially everyone was like, I want to have the right to smoke where I want. But eventually we were able to turn that around so that now smoking is the thing that you don't want to be doing. People, for good or for bad, the judgment is around people who are smoking. We could have a national mandate around masks, which is of course what some people are calling for, people like Anthony Fauci are calling for. And we could think about it, as you all have pointed out, about an individual and collective healing, a way of caring for one another, which could bring us together instead of divide us apart. That would be on the persuasion side. What else can you think of that would work, that we could ask policymakers for around masks?
Well, I think masks can be used as, you can advertise on masks, and I don't mean commercially. I mean, you know, you see so many people in masks that say vote. You see people in masks that say all sorts of different things. There's a lot of messages that can be spread by putting it on a mask. So I think that you know, politically and otherwise, it's a great sort of billboard for any information you'd want to share. So I think that that could also be a good way to get people to wear masks, because people don't want to shut up about a lot of different things that are going on right now. And it's a great way to make your voice heard, to put it on a mask.
Yeah, that's great. That's great. Can you think of other, any other policy things? What might we ask a Gail Brewer or a Bill de Blasio or a Cuomo?
When the smoking campaigns would logically, rationally show smoking is dumb, pictures of lungs and the rest of it, didn't do anything. The most powerful thing they ever did was show a picture of an ashtray and a single slogan: kissing a smoker is like licking an ashtray. And the yuck factor and making it not sexy was vastly more effective than the rational arguments. Visual imagery can have a huge emotional impact. If we promoted the fashion stuff that they used to do in Bryant Park and show that masks can be sexy, gorgeous, desirable people, the way they sell eyeglasses. They don't show ugly people wearing eyeglasses looking uglier. We show them looking fantastic wearing eyeglasses. It's an emotional argument.
Yeah, I love that. I love that. And also, kids were instrumental in the smoking campaign. Kids asking their parents to quit smoking were instrumental. And we did run a community COVID class over the summer that I actually didn't put in this presentation, but we could, where kids made TikTok videos about mask wearing for themselves and their parents. So let's see, we could incentivize it through financing, we could organize around it, we can regulate it, which is what some of the cities are doing. Like, you can't go into a place without a mask, that's a regulation. And then there's personal persuasion, as Larry and others are talking about. So let's look at some of these other pictures then and see where we are. I cannot see the chat because when I have the full picture on like this, I don't see the chat. So Agnes, will you let me know if there's anything in the chat?
Yes, of course, no worries. I'll also interject if somebody has their hand raised or anything, let you know.
Yeah, I can only see a few of the people at a time, and because of the way my screen is shared.
Okay.
So Larry,
I will be your other pair of eyes.
Thank you. I thought this was really, really interesting. Larry took this picture, and Larry, do you want to see your words, or do you want to just tell us about it? I have the next slide is the words of the empty schoolyard, but maybe it's better if we do it with the schoolyard. What do you think? Oh, you're on mute.
The schoolyard, that's fine.
Yeah, okay.
We tend to forget, an artist talks about negative space. It's an empty schoolyard. I find there's nothing more poignant than thinking of the kids who aren't there. Schools are not just taxidermy where you stuff heads with facts. They are the living embodiment of social policy. We feed kids, we check them that they get their vaccinations, we check them for eyeglasses, but in the era of COVID, are we sure that they're not only getting to an ophthalmologist, but are they getting glasses suitable for reading with a laptop? There are a lot of things schools can be used for. And in the spirit of CVPR, talk to the teachers, talk to the PTA. This particular schoolyard, this particular school is a very active PTA. I have a high degree of confidence. We reach out to them, they would get involved using the school to get to the kids to find out who's getting vaccinated, who's not. Just the regular stuff, DPT, measles, the rest of it, polio. A lot of kids aren't getting vaccinated. This is a mental and emotional hook that would lead to it. And if we did it well at this one schoolyard, there's a National Association of the PTAs. We can cookie cutter it nationally. requires very little funding.
Yeah, these are, I think you made, there's like so many good points here, and so I'll highlight a few. So this was what Larry sent, and I think, it brings up some really important points. I'm going to stop the share for a minute so we can talk about it. A couple of the important points that really resonate with me on a policy level. The first one, I think, is that it brings to light, what do schools actually do? Like, what do they do now? Like, it's way more than just education. It's healthcare. It's, I don't mean this in the derogatory way, but it's babysitting for working moms. So I don't mean that they're just babysitting. They're doing so much more. But like, when the schools are not functioning, we didn't credit them, I don't think, up until this point with everything that they were doing. They were safe, a safe place during the day. They were learning, they were healthcare, they were meals, they were all of those things. The schools, all those things, plus outdoor exercise. So I think for this one of the things that it highlights is, what does a school do? And then the second thing that it highlights is, can we open up our outside spaces? Now more than ever, the outside spaces should be open, not closed. So how can we open up our outside spaces? So then we go back to the policy. We can go back to our policy thoughts here. Let me just see. I don't know, this is probably not the right thing, but. Oh, good, it did. So here's all more what Larry was saying about the absence of a laptop, internet connection. I know for the City University of New York, actually, to your point, Larry, and possibly to your delight, the City University of New York is actually distributing hotspots, not just laptops, but hotspots, for the same reason that a laptop just wasn't enough. And then, what can we do? So I left this one here, thinking about schools and playgrounds. I thought we could now kind of take it over as a group and think about what kind of policy levers could be applied to schools and playgrounds. Like, would there be a way to incentivize them through payment, through regulations, through persuasion? What would we recommend then to policymakers that be done regarding schools and playgrounds? So I think we can start off with the financing one. I think is very interesting, because maybe they need to be financed. We've put a lot of money into hospitals and basically hospitals and doctors' offices as a form of health. Maybe we need to put that type of money into the financing of school health, which would keep people healthier. So if we incentivized, for example, payments at the school level for well checkups and immunizations instead of at the doctor's office, we might get better compliance and more money into the schools. What else could we do?
Liz, may I interrupt?
Of course.
It is a little known statistic, but long before COVID, I think only half of American high schools even had a school nurse. Kids would have peanut butter, anaphylactic shock. The gym coach would not know how to use an EpiPen. So they're creating a small telemedicine tool based off a cell phone. Given visual communication, a doc can see the kid. The doc can say, no, put it to the left an extra inch. It needs almost no equipment except just a cell phone. But these days, a cell phone can be the base for an EKG, a digital audio stethoscope, many other tools. You could create a telemedicine tool to help promote this, and very, very cheaply.
Yeah, well, or network the school nurses. I have seen that, because I work with somebody who works with school nurses, and the school nurses there's a researcher who I've been in contact with who calls herself the relentless school nurse, who's really, really trying to push on school nurses over time, when nobody was looking, have been managing diabetes and asthma and anaphylaxis. And it used to be like somebody's mom that didn't want to have a job in a hospital, but now it's their frontline providers. So what about like playgrounds? How can we open those back up, I think, is another good question. Why did we close all of our outdoor spaces? Outdoor was actually the safer way to be. So, maybe safe ways to open up those outside spaces. Good. Other thoughts? This safer streets slide actually belongs with the with the ones with the tree, but and I started filling this out for the group. Oh no, I know what this belongs with. Sorry, this belongs with these shoes. I'm going to show a few people's different thoughts on shoes, and then we can talk about what the policy implications of these types of shoes are. So Larry had I had used shoes as an example, but it didn't have to be shoes. But Larry's been very much walking with his shoes. And we have another person who was also said that she had been walking. So I don't know, Joyce, are you here?
I don't see her on the
Zoom?
the call, yeah.
So she used to go to a gym, but now she's been walking. And so she was talking about walking and using home gym equipment. And Larry and I both have been walking more and more outside. 800 or 1,000 minutes, you said, and wore them all out. So I thought a lot of people are walking right now because they're nervous about the gym. I don't know if other people on the call are walking, but a lot of people are either nervous about the gym or nervous about public transportation. And in either case, it's gotten us up and walking. So I thought we could think about the safer how we could finance, organize, or regulate around safer walking. So one thing would be, I don't know, like we could we could do a little urban planning around the streets. Like if you could walk down going one way and come up the other, it would reduce the number of people passing each other. So what else could we do that would help people who are walking now more than ever from a policy perspective to have a better, safer way to exercise?
I'm a big believer in competition. You can have people set up as teams for how many minutes a day they walk or how far they walk or races and things. Anything that creates a sense of competition and community together.
Yeah, I love that. I just put Larry's shoes up because he's talking.
Mimi Jackson said, yes, we walk daily. And from my point of view also, by where I live, they had closed the streets down, so there was no cars passing by. So people had that whole avenue to just bike ride and walk, run. There's kids sitting down with the chalk on the streets too. It's quite nice. Oh, Joyce just joined the call, by the way.
Oh, she did?
She's connecting, yes. So.
Okay, Joyce, we were just looking at your at what you submitted. Are you able to tell us a little bit about it? And we were thinking about the ways that we could make walking a little safer and more enjoyable for people.
Okay. Joyce, if you can't speak into your mic, you can also write on the chat function at the bottom.
All right, we can come back to her.
Yeah, no problem.
I don't know, let me just say. Let's see. All right. Oh, yeah, I don't know now if this person is on either. Oh, maybe. Looks like yes. Maybe.
I don't see him.
Okay. This is one that really I think we can all kind of weigh in on, though. This is the food banking.
I'm sorry. I just wanted to jump in for a second. So I heard when you were going over like the masks, which was the one that I submitted. So I'm not sure if I was called on prior to that, but I actually, I wasn't I wasn't able to speak at that particular moment, and like I was trying to kind of multitask.
That's okay. Do you want to tell us about a little bit about the mask? We did do that one, but we can always go back and then we'll catch up to the food banking one.
Sure. I mean, so I was listening to you though. I mean, I heard when you linked it to like policy and talked about how, you know, other ways in which you know, we can make it policy, and you know, you talked about the mandate and all of that. So I was definitely listening. It's just that I was I was also in another I was also on a WebEx at the same time, so I couldn't actually like speak. I had like both on mute. Um, but yeah, so yeah, like I said, you know, this is my collection of masks, and yeah, I chose that because I felt like, you know, well, prior to even choosing that, I saw the example that we were given about like the sneakers, and I felt like, you know, masks. This is the most, I guess, prevalent, you know, thing that defines that out, in my opinion, that like would define this year, or that would define this this COVID time that we're in. I feel like it's pretty much impossible to not own a mask at this point. Like even the people who are, I guess, like anti-masks, they can't really even go anywhere because masks are required everywhere. And so to me, it was kind of like a no-brainer to just choose that.
Yeah, no, it's become, you know, ubiquitous. And before we leave this this mask thing, Larry, I will actually thank you very much for that, and we'll you know, stay tuned to the best that you can. I do want to go back to food banking, then Larry, I do want to run into the other room and show you something that I also believe that the light competition can really help us. This one, you don't need much of an explanation for, but if this person is on the phone, you can tell us. So this is a food bank, and obviously the policy implications of this are enormous.
Excuse me,
yeah.
Elizabeth, I'll just interject for half a minute. This is Reverend Bruce Rivera from Christ Church in the Bronx. This is his food pantry in which they give out food to the community and it's located in the South Bronx.
That's great. Is there anything else that you can tell us about it, or?
Well, I do know that the food bank was open for a period of time, and then the church people decided that they wanted to close it. This is before the COVID. Then after COVID came in, the church, because it's a commuter church, and a commuter church is sometimes a church where people are coming from different places to the church. It's like growing up in a family church and moving away, and then you come back as an adult. So it's a commuter church. And I know that after the COVID and all of that started, the church became so extremely involved, and they opened up their food pantry, and in addition, the pastor's son opened up, I don't remember the exact number, it could be 5 or 10 additional food pantries, all over the South Bronx. And his son gets support, they raise money, and it's very intricate, and the church is extremely involved in all aspects of caring for the community through the pantry. So, and in addition, they've also got involved because, again, sometimes when you're in churches, you don't see it. You see the needs of your congregation, but a lot of times, if the needs don't come through the door, it's just sort of doesn't translate. So they have also been extremely involved in giving the community naloxone kits for overdoses, for substance use disorder. And the church was so delighted, they were so happy. I got call maybe about now, maybe 2 or 3 weeks ago, and they were able to document that they had saved a life by giving someone a kit who was not a substance use disorder issues. She didn't have any issues, but her neighbor came over and said, my husband is not breathing. He overdosed. And she gave him the kit, and the lady went and did the naloxone on her husband. And the whole church just rejoiced and was happy about that. So this church is really now becoming much more involved in everything that's going on in their community as a result of the COVID, in like in a really, really personal and a much greater way than they had been in the past.
Yeah, that brings up a lot of very interesting issues, and of course there is a one of the things that can struggle with a little bit right now is the separation between church and state. Right, they're filling so many important functions, but they can't really be funded, but they must be funded, right? So how can they do that? So then thinking back to some of the policy things, the financing and payment for churches would be really questionable. But we could also, and not questionable in a bad way, just like I think it brings up a lot of ethical issues that are not really part of this lecture, but they're trying to meet needs of the community. So how can we help them meet those needs? Or if not, I mean, they can't just keep meeting the needs of the community and get no money ever. That's really not a way that's sustainable. So some of the things that I started thinking about in terms of these food banks, and more people are taking advantage of them now, is things like incentives for restaurants. I know there's been a great movement around redistributing school meals, since they've served such an important function. Restaurants, other people, is there organization or regulations around the food that we can help get people? Is there food for, I don't know, USDA food like they used to distribute a long time ago? Like, what are some of the other options that we have to help people who are in need of food right now, get the food that they need?
Well, you're absolutely right. I know in Brooklyn, one of the churches is getting federal funding, federal money, city money, and they distribute 10,000 meals a week. So people are online 7 days out of the week, and it's totally volunteers. Everyone's volunteer. So they have, and it's multi-everything, multi-ethnic, multi-faith, even though the church that's sponsoring is a Protestant church, but they welcome everyone wholeheartedly with open arms. And they are really, really, and everywhere they can get money, everywhere they can get funding, and everywhere they can get food. And there's always a line.
So Lula May, what would you ask, the Gale Brewers or the Bill de Blasio's? What would we, what is our ask of them? More funding, or?
I would ask them for funding, or even because sometimes you have these warehouses full of food that hasn't been distributed. I would ask them to give restaurants credit, give food banks credit for the food that they give out to the community members. Because I think it's all about, it's supporting. So if they give them credit, that will keep the restaurateurs in business. If they give the people who have the warehouses credit, that will keep them in business. And if all the food goes to the community, it will keep the people happy. At least they can eat. And I think like in the public school around the corner from my house, the principal of the school wrote a grant. And in her grant, and I thought this was phenomenal, in her grant, she wanted to teach elementary school kids how to eat vegetables and produce. And so with that, all of her teachers had to take cooking classes. All of the kindergarten teachers had to take cooking classes and learn recipes, and then learn how to teach this to the children. So when the COVID started, this school went from just giving the kindergarten kids food to giving the community food, and giving them little papers and forms like you have when you have the farmers markets. And the farmers markets, they used to teach people how to cook. So, so now in the school, they would give people recipes. Because again, I live in Bushwick, I live in an ethnic community, multi-ethnic. So there's a lot of people that may not eat certain things. So they were giving out cucumbers, and I'm thinking everybody eats cucumbers. And people would say, oh no, my kids never ate a cucumber, they don't. So they gave out recipes. So they started to give out recipes, and they would feed families. They fed the seniors, they fed the children. And this went on all summer until they opened the school. When the school opened back up, they stopped it. But I thought it was great. So I think Bill de Blasio and I think the politicians need to really think about how food is being distributed in the communities. And I think they need to help the churches do the work, because a lot of the churches are trying, but they don't have money. They don't have grant writers, and they don't really know how. So they're reaching out. One of the things that went on again in Bushwick that I thought was phenomenal is that our police board, which is like a community board, what our precinct did was they collected money and they gave out food. They called the food banks, they called in, got free food, and the precinct distributed food to the community along with the churches. And I thought that was very, very good. And one more, and then I'm going to be quiet. One of the things another group did, a community group did, and I thought it was phenomenal. I thought it was so great. I was walking down the street and I saw this, it looked like a locker. It was green and blue and purple, had flowers on it. And I said, boy, who put a locker out here? And it said free food. It was a refrigerator full of food. And next to it was a gem locker full of canned goods. And I thought that was great. That was just the community people supporting community people. I said, wow, great, great.
Right. And I love the community support of that as well. But to make it sustainable, I think we need we need policy, we need funding. So
Yes.
I think it is amazing. I think all of this is amazing. I love of course, it's a win-win-win for police to help distribute food to community.
Yeah.
Them, obviously. I mean, I think these are all important parts of this. I also think that in the days of COVID, it's more complicated than ever. But for a very long time, I thought that the regulations around, like if a hotel has additional dinners that were never served, they have to throw them out. That's heartbreaking to me. How we deal with excess food. I don't even want to say food waste, because sometimes it's not even ever been touched. It's trays of wrapped things that have never been touched. So how can those be better, repurposed? So there's a lot of policy regulations that could help people. We can't, I don't think, solve it, but we could do a lot better than we're doing. This can't be the best that we can do.
Right. I've seen a community fridge in Queens as well, with like cabinets with canned foods, to add on to what Lula said. So I thought that was fascinating. But Larry has his hand up now.
Oh yes, please, Larry.
Go ahead.
Yeah. There is the concept of lifeboat rules. In lifeboat rules, you say, this isn't normal. Our lives are on the line. We might have to do things a little differently right now in the lifeboat.
Mm-hmm.
We have more than enough food creating capacity and more than enough food distribution capacity in this country. We do have to change things where farmers used to make a certain kind of potato because the French fry guys in the restaurants sold them, and when the restaurants are closed, they're throwing potatoes away. They're perfectly good potatoes. It would be much better if we gave them some kind of financial support at the farmer side, got the food here, and gave it away, because they are literally dumping potatoes. And if you go through the news over the last several months, you will find that story repeated in food industry over food industry in each of the different kinds of commodities. COVID's been horrible, but we still have huge resources. The challenge is not a lack of resource, it's resource allocation. I'd much rather take so many people who are out of work. They're not lazy, they're not stupid. The restaurants are closed, or their factories closed. They're also probably bored out of their minds. They're a huge potential workforce that we can enroll in a lot of other ways. We can use these resources. It's not that we are powerless, but we need to think in slightly different ways. It's lifeboat rules.
Yeah, I would agree. I would agree. And I think too, some of the previous regulations have guided some of this work and have changed the framing of it. And I'll give you an example. It was a huge, it was a thing to be celebrated, a huge accomplishment when WIC, the Women, Infants, and Children, when what was previously food stamps, the food vouchers could be used at farmers markets. That changes things. When something like that, when they make a policy decision, like where you can use those types of vouchers, it changes things. So again, thinking about this policy lever, I think is important, because this is one way of taking the community voice, or what you see, literally what you see, what you can take a picture of, what there is in your community, and thinking about how to get a policy, how to get your arms around the policy piece of it. So I think I have just two more. This person, Francie, never joined, right? Agnes? I don't think she did not yet join. So I just want to say one of them is this other slide that she sent in about, she saw this picture. I guess she likes the juxtaposition of like things against other things. And it says, all loved Alfredo in God's hand. So it's a little bit of a memorial to this man who obviously collects bottles in the street of that street. And so how much and how little we know of each other. And again, just thinking about a way that this can bring us together, she wrote a little poem about it. Dory, this one is yours. I thought both of these were things about memory, thinking about how we honor the memory of something. So do you want to talk a little bit about yours for a minute?
Sure. Hi, everyone. So I work in a senior center. I'm the executive director, and every year for Thanksgiving, especially, we have a very big feast on Thanksgiving Day, actually, and the whole entire staff get together and serve the entire community. It's a free event. Everyone that gets there and we had the capacity for over 200 members to be there, and Thanksgiving was one of our biggest parties. So they will come with their family. We used to serve them traditional Thanksgiving dinner, and we had raffles and party and live musicians, and party used to start from 12 to 3:30. So everyone was there partying and celebrating life and giving thanks for actually being there. So this was a picture from last year Thanksgiving, and it came up to mind because now that we're not in the center, we're not allowed to have them around the center at all. Every time we call them, they keep asking us, when are we gonna reopen? When are we gonna be able to come back and actually be with our friends? We're our second family. Like, I have seniors that will come to the center like regular staff. They will come from 9 in the morning to 5 o'clock in the afternoon. It was like their job just to be there, just to be with their friends. So I think it just reminded me of what we keep losing. We keep losing that socialization and that community. But we're trying to do the best, but we still not reaching the best that we know we can do for them, especially since they are the most vulnerable population right now.
Yeah, that was a little bit more than what was in your paragraph. And
I'm sorry.
No. It brings up a different, I thought you were kind of honoring the memory, but actually you bring up a more relevant point, which is what do we do? People, it really speaks to the isolation and the loneliness of our seniors.
Yes.
I agree with you. What senior center are you at?
Arc for Washington in Washington Heights.
I've spoken there. I thought that looked familiar. I've spoken there so many times. I did the All of Us program there.
Yes.
You remember? Yeah. So that's what I thought, actually. So yeah, that's a big place and a big community hub, and how are people gonna be connected to one another? And I've actually been to other senior centers where the free lunch, part of it is the free lunch, but a lot of it is the socialization.
Correct.
Yeah, so what will we do, and what kind of policies can be done, and what can Bill de Blasio or Gail Brewer or others do, or Andrew Cuomo do to help us keep our seniors connected? And I think there's probably a lot. Like, I know in the AARP journal, there was a lot about like how you could set up like people to call so that people reach out, and they even had it so that different people call different people all the time. It wasn't meant to be like a relationship, but just to check in on people.
So yeah, so we do have activities going on online and telephone conference with the workers and a couple of the seniors that know each other for them to continue being connected. But what we noticed also was that only 12% of the Washington Heights seniors especially are able to work Zoom or actually have the capacity of understanding or have the tablets or the internet to actually join and be able to join and be in an activity and participate with everyone else.
Right, so either getting them tablets, getting them, again, for the policy part, getting them tablets, making tablets available, or send everyone, send everyone who requests it, who's a senior, and have a tablet distribution program, or a place where people can meet safely outside. I mean, the idea is to kind of draw policymakers into helping solve some of the problems through that policy work. So and all at the same time, I thought it was also, in a sense, that these two were thinking, when I put them together initially, I was thinking about honoring what we've lost. In a sense, we've lost people, but we've also lost tradition. So another thing that you can think about from a policy standpoint, in this one, I would much rather solve it for how we can break into this, get people back connected to one another. I know, again, I was a frequent visitor for a different reason at a senior center's free lunch program closer to Columbia University, and it was like the high school cafeteria. People that they sat with every day, it was like that. So I think it's really important to still yet think about that. But when I first read it, I was thinking about honoring, the experience that we've been through, and how maybe the city, we're all in such pain. Is there a way that the city can honor the experience that we've had? So these are some of the ways that we've honored things in the past, Harriet Tubman or 9/11. So I started thinking about what will we do to honor the experience of COVID, the people that we've lost, the traditions that we've lost, and also, what can we do to heal ourselves and each other? So that was what I had. And I think opening it up for discussion would be great.
Liz, sometimes I find that my first reaction is often rage. And if I keep my mouth shut for a moment and calm down, I go down a layer and find out what's really pissing me off. We lost 3,000 people on 9/11, and we built a memorial, and we put up the blue columns once a year, and we try to see that their death means something. I would like to see that the death of what will be 250,000 sometime this month, 250,000 dead, I'd like their deaths to mean something. And when I was listening saw the picture of the Thanksgiving and the memory of what it used to be, I don't see any literature, music, or art that is expressing what we're going through now. And that's going to be part of the healing process. Just as South Africa had a healing process, the two Irelands had a healing process. We're going to have to deal with this.
I couldn't agree with you more. And also it helps make it, it's a reality, right? So I think some people, it's a little bit like Holocaust deniers. you know, we have to also do it because it's a reality.
Well, I think without question, I mean, there are lots of things that, I mean, no one really knows how to handle this because this is a new situation that we're in. A pandemic is, while the potential was always there, right now we have an enormous problem on our hands. And I live in a neighborhood with a lot of senior citizens. There are a lot of people who have stayed in place for a really long time. And my neighbor across the street is 103. I have two other neighbors, one 95, one 92. Who I keep in close contact with, and they all went to the same senior center, but which is now closed. And there are things that we do need to think about, but the problems are so individual, you know, food banks and, you know, we can talk about so many things. Sometimes the problem isn't, you know, you can give someone a bag of potatoes, but you haven't really given them food if their oven isn't working, you know? There are so many individual problems that need to be, you need like a heart-to-heart connection in order to solve them. You don't really know that the bag of potatoes and the box of rice doesn't help the person whose stove isn't working or the person who's having low vision problems who can't do it right now. So those kinds of things, I think, are the, you know, those are really the problems that we have to tackle individually, person to person. And that's, I don't know if there's a policy that can, any kind of policy actions that can take over for that. But it's great that the resources are there. Like Larry mentioned, you know, there's plenty of resources. The problem is that really making it helpful to individual people. I mean, I worked at the food bank at my church once. I was not the food bank, the soup kitchen. And I was really kind of worried about working at the soup kitchen. I thought it was going to be this horrible, sad thing, and that there were going to be all of these like dirty homeless people that I'd be feeding. And I saw all these people who looked like me, just different circumstances had brought them to the food, you know, to the soup kitchen. And I thought, you know, this is a great solution for people, but I never would have ever thought to come here as a volunteer or as a person who needed a meal. I mean, people know that you can run out of money, you can run out of ways to do things. You can run out of money for a minute and be okay when the next paycheck comes and those kinds of things. If I don't know how you get down to the nitty gritty of solving individual problems for people. That's a huge thing too, like the person to person connections.
Yeah, and I don't want to imply that policy can solve all the problems. It definitely cannot. It's everything. It's individual, interpersonal, community, national, policy, world. It's those concentric circles that go out and out and out and out. And you know, our individual behavior really does count and really does matter, but so do the resources to do it. So does the interpersonal behavior that we have, our education and everything. It builds like that. So it's definitely not the single solution, 100% for sure. But one thing that it does bring to mind, your comment does bring to mind, is that there's an individual checklist that communities can develop that policymakers can address. So everybody, in order to be safe during this pandemic, everybody needs heat, light, an adequate supply of food, you know, an internet connection, a minimum set of things that we can identify, because by doing that, one thing about and I'm a nurse now for almost 40 years. The individual approach sometimes doesn't work because the people don't have the resources, the knowledge. So we need a combination of both so that we can support individuals in doing the things that they need to do. Nobody wants to be unhealthy. Most people want to be healthy, but there's somehow we haven't designed the system to support that in so many cases. So I agree completely that we need that individual assessment. And for people that know me, my work is geared on and dependent on, and would advocate for the fact that it's at the community level that the work needs to be done. That if we can get communities situated correctly with the right supports in place, that we may have a chance. But a lot of the things you said, Mimi, about the individual are 100% true. A bag of potatoes or a bag of rice does you no good if you have no stove or no way to cook it. So it's exactly right. But how do we, that I just don't know how we go about finding all those individuals. And maybe if communities come together, we have a shot at, I think, at identifying where those needs are or how to connect people to them locally.
I wanted to just connect the dots with some of the things that Natasha was talking about last week. And that was in talking about the expanded food and nutrition education program, which is, community members who participated in workshops that are around, identifying food, identifying opportunities for activity, really kind of tailoring, nutritional information to the circumstances that they're facing. The kind of the ethic that underlies it is each one teach one, each one reach one. And it's really looking at helping people to know about, being able to use resources at farmers markets, the food and vegetable prescription programs and things like that. And it's this really weird thing that it's simultaneously really, really large, thousands and thousands of families connected with every single year, just like many of the food pantries and soup kitchens. It's also such a drop in the bucket in a gigantic city like ours. So it's like, how do we scale up and make sure that, the things that are working are implemented broadly and deeply enough that they can work for everyone?
I would agree, very much so. Other thoughts?
I was just thinking that, like, for the senior centers, they're providing food for the seniors through, I think, the Department of Sanitation or something like that. And I think it's a big mistake that we didn't have anything planned before this, because it rolled out with so many mistakes, so many problems. And even now, when they're thinking that they're going to be closing it soon, it's still not working properly. And there's still no idea of how they're going to really replace it, or what's really going to happen, if that's going to work. And there's a lot of people, older adults, that don't want to go out because they're very scared of what's going to happen to them. And they're still not sure how that's going to be working, how they're going to be getting food, and if the food that they're going to be getting is okay for them, or if it's going to be something that's going to get them sick, because not all of the food that's been given out to them is good, I guess. I'm not really sure how to say that. I've gotten complaints in all kinds of ways of people saying the food that I'm getting looks like it's gone bad, it smells, and I don't want to eat it. But if I don't eat it, I don't have anything else to eat. So it's hard to say what could have been done now, but something should have been planned beforehand, and it wasn't. And a lot of people are suffering for it.
I'm sorry, can I ask you a question about the food program, Jessica? I don't know if you know or not. Is that meant to be survival food, or is it meant to be food that you can eat? And I have my best friend actually takes care of her 90-year-old father. And the food that he gets, she sent me pictures. It's outrageous. I mean, it's awful. If you were starving in the woods, I could understand, but it's not something that would maintain, it would keep you alive. But I mean, yeah, I'm not exaggerating. It's really, really awful.
I've gotten some calls telling me that, oh my God, I don't think anyone would eat this. I wouldn't give this to my animals. And I'm like, yeah, don't eat it. But then they're like, but then I don't have anything to eat and I'm
Right.
hungry.
I want to
Right.
remind you of the noted philanthropist Jared Kushner, who said, people are poor because they have to really want to be rich. The
Let me
current
not
state
go
of what you're
there.
describing is an accurate representation of a conscious government decision. It didn't just happen.
Hmm. Yeah, I mean, I've seen meals that have like 3 peas. You know, like you've got a meal that has like a hard-boiled egg and 3 peas and like dressing and no salad. And someone put this together and sent it. It's
Some of you may
amazing.
be too young to remember, but Senator Hines once had to stand up and say, I speak with authority and tell you ketchup is not a vegetable. The FDA was actually trying to make ketchup count as a vegetable for school lunches.
Wow.
Also, Mimi, just to add, like you said before, a lot of the seniors, we don't have the control of what food they're receiving. Some of them are receiving cooked meal every 2 days, and some others are just receiving canned food or food that they have to cook on their own, dry food, like pasta and stuff. And like you said, what is that good enough if they can cook for themselves or if they don't have a working stove?
Yeah, it's amazing.
So I just want to say, Mimi, that, cycling back to the photo voice, and what you guys are saying, I think actually is a really interesting way to think about this and also end on that note. But you're saying, like, they sent me pictures of what it was and nobody would want to eat that. So I would say for this problem, which is terrible, I'm sick from it, that one thing that we could do, I don't know where those meals are coming from. I'm not sure what program you're talking about, but if we took the pictures, take the pictures, show the people's, if people are willing, show their faces, show these meals that we're asking people to eat, and show those to policymakers and say, this is what this is. This is how this rolled out. Can you help us fix it? Can meals be provided that people want to eat through restaurants, schools, what we said before? I mean, it's
Right. I'm trying with my friend. I told her, I suggested to her that maybe we send the pictures to New York One.
Yeah.
But her father is very proud. So he doesn't want the embarrassment of being the poster child for this. So I said, well, maybe you could just send a picture of the food without his picture included. It takes away kind of the personal touch, though. But we were trying to figure out how to get someone to listen, because the food doesn't always come either. It doesn't come when it's expected. So sometimes it comes and it's supposed to be food for a day, and it's not even enough food for a meal.
Well, I'll tell you, this is Ulame. In Brooklyn, they had the exact same problem. Some of the food was old, some of it was rotten, some of it was growing green, was growing different things when they were delivering it to the seniors. So the seniors took pictures. They gave the pictures to the Brooklyn Council of Churches. The Brooklyn Council of Churches took that to the Brooklyn Borough president. And he really came down very, very hard, and he went to the city, and they really had a tumultuous time. And from what my understanding is, the food isn't perfect, but it has improved in those sites in Brooklyn, which was primarily the NYCHA housing. A lot of the people in the NYCHA housing complexes were complaining, the seniors, about the food that they were getting. So it was really very, very difficult. But if you can get more people together, more people in that community, more people who are receiving the food, and take pictures. Maybe you don't have to take faces, but take pictures, because I know the Brooklyn Council of Church, it was primarily the pictures of the food. The food was terrible.
And I just want to say that the only reason to take the pictures, many times Photo Voice doesn't include your picture at all. That is not a requirement of this technique. It was only to personalize it so people are like, hey, these are real people receiving these real meals. But by virtue of this method, it would actually only be the meal itself. But essentially, you could ask people who are getting these meals, many of them, to take pictures, because a lot, like Rumi and I were talking about, if we did an exhibit at some point. But if you can imagine that you did an exhibit of, of all of these meals, one after another, and it would, any legislator would have hopefully have the same reaction, like, this can't be, we have to do something about this. So that's
If you want to make a story really have an impact, it needs emotion. It's one thing to have a tray of food, even if it looks awful. It's another thing, somebody wants to protect their identity. But the picture of that awful food and an old wrinkled hand holding a cane next to the food, that has an emotional wallop that the tray alone wouldn't have.
right.
Yeah.
This is Maurice Franklin, and I'm in Harlem, and I wanted to make a comment regarding the food. First thing I wanted to say was regarding, someone made a statement about all of the loss and death and dying and how we memorialize. I think, Larry, you said something regarding that. And I wanted just to comment that some of us are living through a second pandemic. For those people who have lived through HIV and AIDS, I mean, there's some, those individuals in those AIDS service organizations and those individuals involved with that have a history and a memory, and they kind of had to jump into the fire, kind of like we've done in this last 6 months, trying to put a fire out. So I've looked at those organizations, those individuals. They do have that knowledge and that historical memory of how to engage the federal government and how to get involved. We need to save lives. And then the other thing I wanted to mention was around food deserts. I'm sorry about the noise in the background, by the way. That we do have, in Harlem, the same issue. I actually went to a pantry in the spring. I had to go, and so I would go every once in a while, and I noticed that it's almost like you don't really want to say anything, like you're embarrassed to say anything about the food that you're receiving, because you should be grateful, right? And you are. But I was telling a friend last week, I said, this food that they're giving individuals, I mean, they give an adult for lunch, you get a cup of beans and a cheese sandwich, and maybe some Jell-O and a piece of fruit, and that's supposed to last you till for the next day for 24-hour cycle. If you have kids in your space, they're getting milk and cereal. No, a lot of African Americans and people of African descent are lactose intolerant, so that to me is a non-starter. To give me something that's not even good for me to begin with. But you want to be grateful because you're getting something that's sustaining you, but it's not really. It's bad for you. It's bad for your health. Everything they're giving you, but I don't know how we improve that. I volunteered in Newark for every Friday. I'd go there for the Urban League and volunteer for them as they were giving out food, and they were giving out food from HelloFresh. I mean, I said, you're giving individuals whole chickens, potatoes. They're giving them full meals. I mean, they're giving them enough to last for an entire week. Things that are that are of substance. But here in the places in Harlem, at least, where the food is it's for adults, it's not very healthy. That's the comment.
Sometimes it almost feels like they're saying you're not worth getting good food or something that's going to be nutritious to you. It's almost like they're saying, this is what we have left. Take it or leave it. It's up to you. And
absolutely. And keep in mind that some of those people are volunteers too, but even if you walk by, they don't even look like they're really excited about giving you the food. They may be embarrassed, I don't know, but it does feel like it's, you're the last of the least and you're getting the least and you need the most.
I get the feeling that this is a particularly American problem. I've eaten on a Native American reservation, a Pima reservation in Arizona, and that was the most beautiful feast I've ever had. And it wasn't money that it was, it kind of reminds me of one of the homework assignments we had was a guerrilla gardener. And they were just using what they had. They were farming and they were serving these incredible meals. I tell you, eating on that Native Indian reservation, Native American reservation, was fantastic. But I think we have kind of a different idea about what it is to be charitable. Well, I don't know, charitable is the word. To serve everyone. it's kind of like we need to make a mental shift maybe when it comes to our policies and really think about what individuals need.
Right. I mean, this has been a very rich discussion, and I'm very thankful for it. I agree with that completely. And so I do note that it's 12 o'clock, and I think some people are probably need to go, but I'm very happy to stay. I'm also very happy to come back and talk more about this and other things like it. I can see a photo voice about how, what it feels like to visit a food pantry, a food bank, or a free meal, just showing people what the experience feels like. I think people are hesitant to be the poster child, as you said, but with a number of people, when everyone's having that experience, or many people are having that experience, and show it all at the same time, it can be a very powerful way to go. So I wanted to thank you, Agnes, and Lula May, for the invitation to share our work. And it's been really great. And you have my contact information if people want to get in touch.
Yes, thank you very much for this wonderful presentation.
Thank you so very much. Wonderful presentation. And don't worry, we're going to have plenty of questions and plenty of follow-up. I think there's a lot of people that have a lot of things that they'd like to ask you. But thank you so much for taking the time for this. It was phenomenal. I loved it.
All right. Thanks, everyone. We'll talk soon.
Okay.
Thank you.
Thank you.
Thank you, Liz. It was a beautiful presentation as always.
Always lovely to see you. I'll see you very shortly, I'm sure.